coxal bone. It is time. All right, let's learn the landmarks of this. So we have a coxal bone here. We have a coxal bone here. Now, first thing that we really need to do is figure out how this sucker goes, right? So let's take a moment. First of all, it goes like this, okay? And you're thinking, well, all right, that doesn't help me though. You're right. So when we orient a coxal bone, so it's just hanging out in space, when we orient it, we need to know a couple of things. First of all, this is the socket for the head of the femur. So I have a femur here. Femur is the largest and heaviest bone in the body. And because of that, I can't even fit it in the screen. It's enormous. But anyway, it fits in right here, okay? Just like this. Now, we know that the femur or the leg is on the lateral part of the body. So when you are orienting a coxal bone, you know that the socket, which is called the acetabulum, by the way, points laterally, okay? It has to point out laterally because that's where the femur is going to be and that's where the leg is, okay? So that's really, I think, one of the most important ways to orient the coxal bone is to make sure that the acetabulum is pointing laterally. Okay. By the way, does anybody know what the word acetabulum means? Did you look in your book? Acetabulum actually means little vinegar cup, which is bizarre to say the least. Can only imagine someone putting vinegar in the coxal bone of their enemy. I don't really know. That's what it looks like to somebody at some point, and so that's what it's called, the acetabulum. Okay, so the acetabulum points laterally. Now, the second thing is, you have a big flat area right here. This is called the iliac fossa. Now, this is going to point medially, okay? But with that, you're going to have the pubic bone here. This is going to face forward. So if the pubic bone faces forward and the acetabulum faces laterally, then you're good to go, okay? If you're holding it like this, well, okay, the acetabulum is facing laterally, that is true, but what's this? Right, that's not the pubic bone, that's not something I recognize. And also, this isn't the iliac fossa. This big, broad, flat area is. So we got to turn it around. There's the pubic bone, iliac fossa. These are facing forward or medially. And then the acetabulum is facing laterally. So that's how you can orient this bone when you first pick it up. Okay, because we'll play with these in class. So if you have two of them, of course, it's a little bit easier because you know the pubic bones are going to kind of fit together, and you just put those next to each other and there you go. So it'll be kind of like this. You're missing the sacrum, but you get the idea. Okay. All right, so let's go into screen share and we'll start talking about some of these landmarks. Not that one. All right, so this is the picture in your book. Now, it is pretty straightforward. You know, A, B, C, D, E, this is this, this is this, this is this, okay? Absolutely. We are going to talk about these as we point to them, okay? I actually prefer to take a look at this view because you can see the bony landmarks. There's a little more texture on this view. This is from your visible body, obviously. And you can also see the ligaments that attach to these particular bones. So these ligaments hold each coxal bone to the sacrum right here. It's the iliolumbar ligament, and this is the sacroiliac ligament. And then right here, of course, you can see the pubic symphysis. We also have another ligament right here. This one's called the inguinal ligament. We'll talk about that one in a little bit. but you can see the landmarks a little bit better here. Okay, if I turn everything around, see some texture on the bone. Okay, so we'll go back and forth, I think. All right, so the first thing that we want to talk about, right, are the three bones that make up each coxal bone. We have the ilium, which goes to about here. I'm just kind of putting my fingers around it. The ischium, which is the posterior portion. And then the pubis, which is the anterior portion. Okay, now within the ilium, the ischium, and the pubis, we have specific landmarks. We're going to go back to our, oops, just kidding. I'm going to go back to our drawing from the book. And let's just talk about the ones on the ilium first, okay? First of all the way along the top here is the iliac crest. See, it's very crest-like. That's the iliac crest. On the anterior of the iliac crest, right here, I'm going to put it right up to the camera. See this bump there? That is called the anterior superior iliac spine because it sticks out a little bit. It's a spine. Remember, we had the spine of the scapula? This isn't even remotely like that, but it has a similar name. So this is the anterior superior iliac spine because this one right down here, see, there's another bump. This is the anterior inferior iliac spine. So we do abbreviate these ASIS and AIIS. ASIS, AIIS. Okay, good. So we have the iliac crest, anterior superior iliac spine, anterior inferior iliac spine. And in the center here, this is all the iliac fossa. A fossa is a shallow depression in a bone. And that's what this is. If you were to see it from the side, see it's a little curved, right? You see the little curve in there. That is a shallow depression in a bone, so it is a fossa. Fossa. All right, so here's the iliac fossa. Now, on the posterior side, you can tell that this is the posterior side. You see how rough and bumpy it is? That is because it is going to articulate with the sacrum here. The sacrum is going to fit right against that. The two bones fit together like puzzle pieces, okay? So that is where it's going to articulate with another bone. On the back side, we have another spine, okay? This one is called the posterior superior iliac spine, or PSIS. And then this one, just below it, see, we have another bump here. This one is the posterior inferior iliac spine, PIIS. So it's very similar. We had the anterior superior, anterior inferior iliac spines. We have the posterior superior, posterior inferior iliac spines, okay? In between is the iliac fossa and the iliac crest. So I'm repeating some of this information, but it helps you learn, okay? Repetition doesn't hurt at all. All right, so that's pretty much it for the iliac part of the coxal bone. However, if we turn this around, to the posterior section. Oh, no, just kidding. That's the wrong page, folks. Haha. If we turn this around, this is the posterior view, right? Here's the acetabulum and here's the ischium. So we know that's posterior. We do have a couple of things that show up on the posterior here. They are called gluteal lines. I'm going to show you with this. So they don't really exist. You can't see them, right? There's no line that shows up here. The gluteal lines are essentially markers for where the gluteal muscles attach. And we will get to those but I wanted to show you where the lines are right now. So just below the iliac crest here, you see where the shadow is right there? Okay, that is the posterior gluteac, that's a word, posterior gluteal line. I keep looking over because my little screen is on the side here and I can see what I'm doing. Trying to do everything backwards doesn't always work. So this is the posterior gluteal line right here. Okay, this one, this little shadow. All right, so if we go sort of halfway down the ilium, there's another tiny little shadow right here. I don't know if you can see it on your screen, but right here, right through here, right the middle here. This would be the anterior gluteal line. I would just have to paint it on or draw it on, really. It's just going to be right here. And your textbook has put in a shadow where there really isn't any, but that's fine. Whatever helps you learn it. So that's the anterior gluteal line. And then just down here, right about here, is going to be the the inferior gluteal line, this one right here. Right. So again, these are going to be attachments for the gluteal muscles. We have the anterior gluteal line in the middle. We have the inferior gluteal line closer to the acetabulum, and then we have the posterior gluteal line just inferior to the iliac crest here. Okay. All right, let's go back up here. I'm going to switch over. All right, so let's turn this around here. Right here, we have the iliac fossa. Remember, that's towards the midline. This is the iliac crest. Right here, this landmark right here. Oops, I tapped on it. This one, of course, I can even move it like this. You can see it's very spiny. This is the anterior superior iliac spine. Just below that is the anterior inferior iliac spine. Let's turn them around. I'm going to hide that. All right. So back here, this is actually smaller than your plastic skeleton, but that's okay. Not every body is exactly the same. So right here, we have your posterior superior iliac spine. And right here, we have your posterior inferior iliac spine. Okay, great. Let's move on. Okay, so the next part that we're going to talk about is the pubis. Okay, so the pubis, remember, is on the anterior. So just to give you an idea, just where my fingers are is the pubis. Okay, so this part, this part, this part is the pubis. Everything from here over is all going to be ischium. So this part right here is just the pubis. So we have a couple of pubic landmarks, all right? Not a ton. If we put this to the side like this, you can see there's like a little bridge here, and then there's a little bridge here. Those are rami. That is plural for ramus. In fact, let me stop the share for a second so I can show these up close. So here is the superior pubic ramus. It's kind of like from here to here. Superior pubic ramus. So let me turn this around for a second because I actually put a line on there. I don't think you can see it though, it's really light. So here's the superior pubic ramus. This is the inferior pubic ramus. But I did put a line, oh shoot. Let me see if I can highlight it. That'll work a little bit better. I'm like literally using a highlighter. Okay. Aha, now you can see it. All right. So from here to here, only to this line, from here to here, this is the inferior pubic ramus. So here's the superior pubic ramus, this bridge here. And this one is the inferior pubic ramus. It's only this bridge here to this line. This is the dividing line between the pubis and the ischium. Okay, that's important to know. All right, now, if we go right here, we have the pubic tubercle. This is a sticky outy lump on the front. That's the pubic tubercle. Okay, and then here we have the articular surface for the pubic symphysis. See how it's roughened? Right there. Anytime you have a roughened surface, it's usually where two bones are going to come together or where something's going to articulate. Okay. So right here is the articular surface for the pubic symphysis. Let's go back in real quick. All right. And that's what we have here. So letter F is the superior ramus of the pubis. Letter I is the inferior ramus of the pubis. Letter G is the pubic tubercle. It's on the top here. And then letter H is the symphyseal surface, which is so much fun to say. Symphyseal surface. It's the articular surface for the pubic symphysis. But say that 5 times fast. Symphyseal surface. Okay. And that's it, really. Okay. Now, you have letter E, which is the pectineal line. The pectineal line is actually very difficult to make out because it's kind of line-ish right here, a little bit. When you have a plastic skeleton, it's an area that's kind of carved out a little bit. Let's go back to your visible body and see if we can see it. Pectineal line, not really. Okay, it would be right about here is the pectineal line. The pectineal line is kind of like your gluteal lines. It's not really there, but it is an attachment point for a muscle called pectineus, which we will get to. All right, so let's go back into our posterior section of our coxal bone. In fact, let's turn this around so we can see. We know that we have the acetabulum right here. Now inside the acetabulum, it's difficult to see, but there's a little dip here, right? That little dip is actually going to be an attachment for a ligament. There's a ligament that's going to be in here called the round ligament, and it holds the femur to the acetabulum. So you actually have a ligament within your hip joint that keeps things together. That little dip right there is where that's going to attach, okay? So here's your acetabulum. You're gonna have your articular surface right in here. There's gonna be cartilage and then that little ligament right there. All right. Now, we do need to move sort of a little more superior here. I'm gonna show you some things. This right here, this is the greater sciatic notch. See, it's notch shaped. We'll be talking a little bit about the sciatic nerve with this unit because the sciatic nerve goes all the way down the posterior leg. It's the largest nerve in the body. So right here is the greater sciatic notch. This is the ischial spine. You see that? It sticks out. It's kind of like this and this, you know. This one actually looks like a spine to me. So this is the ischial spine because we are now in the ischium. Okay, from here to here, roughly, is the ischium. So this is the ischial spine. So you have the greater sciatic notch here, you have the ischial spine here, and then you have this little area right in there. That's the lesser sciatic notch. Okay, that's letter H here, the lesser sciatic notch. This back here, this is the ischial tuberosity. It's big, it's kind of honking, and it's roughened. The ischial tuberosity has a lot of muscle attachment to it, specifically your hamstrings, okay? And also a muscle that's the floor of the adductors. We'll talk about that then. But the ischial tuberosity is your sit bone. So if you are sitting up straight in your chair right now with your hips at 90 degrees and your feet on the floor, then you are sitting with this surface, this ischial tuberosity, against your chair. Most of us slouch, right? And we're not actually sitting on our ischial tuberosities. But if you're sitting upright and properly, then you will be directly on your ischial tuberosity here, okay? You can feel this. If you are sitting up properly and you put your hand just underneath your gluteals, you should be able to feel the ischial tuberosity as you're seated, because it'll be a little bit closer to the external surface. It'll be more superficial because your legs are flexed, okay? That's ischial tuberosity right there. Now, remember, we had divided the bone here. So this half was the pubis and the back half was the ischium. So here, from here to here, we have another ramus, but only from here to here. This is the ramus of the ischium. Okay, so we had the ischial tuberosity, and then we have the ramus of the ischium. See, there's my little dividing line here. Just from here to here is the ramus of the ischium. What's this part from here to here? Yep, that's the inferior ramus of the pubis. Good job. Now the hole, we mentioned that in the last video. This is the obturator foramen. A foramen is a hole in a bone. Okay, usually nerves and blood vessels pass through foramen, and you have lots of foramen. You have them here, you have them here. You have this one, which is arguably the largest one. There's one at the base of the skull called the foramen magnum. So all over the body, in the bones, you have foramen, but this is the obturator foramen. And it is, like I said, arguably the largest one. The foramen magnum is also pretty big. Okay, so that is pretty much it for the landmarks of the coxal bone. If we go back into our visible body and we turn this guy around, you can see the greater sciatic notch. Actually, let's go over here because I moved some stuff. You can see the greater sciatic notch is this right here. Here's the spine of the ischium. Here's the lesser sciatic notch. And then this is the ischial tuberosity right there. If we turn this way a little bit, then you can see right in through here, this is the ramus of the ischium, where my cursor is, okay? Ramus of the ischium, but it only goes to about here. All right, so we had the ilium, we had the pubis, and you see they actually even put in a little division. I don't know if you can see that right here between the pubis and the ischium. So all of this back here is the ischium then. Okay. All right, so now we're going to take some time and really study the landmarks of the coxal bone. There are some workbook pages that go along with this, and when we come back, we will talk about the landmarks of the femur. Stay tuned.